This episode was pre-recorded as part of a live continuing education webinar. On-demand CEUs are still available for this presentation through All CEUs. Register at allceus.com/counselor toolbox. I'd like to welcome everybody to today's presentation of the biopsychosocial impact of addiction on family and community. So you might be asking yourself, well, how does this apply? Well, even if your clients are not addicted to something, they may be related to someone who's addicted to something, and they're definitely living in a community where people are addicted. And so we want to look at the impact on the communities and how addiction can actually have negative impacts on the community and create a community that's more supportive of addictions and mental health disorders. And we're also going to look at what we can do as clinicians who may be treating people who are family members of someone with an addiction. So we'll identify the biological and health consequences of addiction and mental health issues on the family and community, the psychological consequences of these things on the family and community, the social consequences, and then we're going to talk about interventions. So the family really functions to protect and sustain both the strong and the weak members of the family to help them deal with stress and pathology. The family doesn't say, well, we're going to keep the strong and the weak are on their own, or vice versa. They're going to take care of the weak and the strong can fend for themselves. The family really brings everybody into the fold. So when there is a family member that is an identified patient, they're not going to be outcast or ostracized. They're going to still be part of that family. So we need to help the family figure out how to function or readjust their equilibrium with this new situation that has presented itself. The family serves as a mechanism for family members to interact with broader social and community groups. So it also influences who you interact with. My kids, especially since they can't really drive themselves yet, interact with groups and things that my husband and I interact with. They interact with their schoolmates. They interact with people at where they take martial arts and things. But the family really serves as a launch pad and shapes where their interests may lie and with whom their interests may lie. The family also provides an important point of intervention, and this is for anything we're talking about, whether it's diabetes, depression, or addiction. The family can help support the identified patient in making positive changes and in doing what they need to do, and can encourage them when the going gets tough. The family influences weaker members in harmful ways due to tension, problems, and pathology. So they're not ostracizing anybody. Everybody is brought into this family, this equilibrium, this unit, and ideally it protects and sustains both the strong and the weak. But if the family unit has a lot of tension and problems and pathology, and from clinical experience we can see how this is true, then the weaker members may tend to start suffering from that. They may tend to experience more anxiety and depression and hopelessness. They're not observing healthy coping skills. They're not observing effective interpersonal skills. So the family can be, as I've said many, many times, the greatest buffer against stress or one of the biggest sources. So we really want to help create a healthy family system to prevent mental health issues in anyone who doesn't already have one, to buffer against the effects of an identified patient that might have a presenting issue, and just to help people live the highest quality life possible. So biological